Good morning, students. In today's topic, we'll be discussing role of physician towards society and community. This is in ATCOM 8.1.1, ATCOM 1.1. So, role of physician towards society and community. So, there are various roles of physician towards society and community. So, first is as a medical expert in diagnosis and treatment of various diseases. So, physician identifies various diseases and treats it accordingly. Then health communicator. So role in health education. So physician plays very important role as educator of prime importance as he provides knowledge and helps in sharpening skills of workforce, that is paramedical force, technicians, nurses, multipurpose workers, and other members of healthcare delivery system or team. Then he plays very important role as collaborator at community level. So physicians they attend CMEs regularly, conferences, workshops, and there occurs exchange of knowledge in these workshops, conferences, and various advanced skills, knowledge can be acquired from their colleagues regionally and nationally. So you can see there is organization of national workshop, national conference, state conference of various bodies, various subjects they organize, and physicians can get recent knowledge, skills from these various activities. Next important is community administrator and social entrepreneur. So physicians while serving society they utilize healthcare system and health delivery in cost effective manner along with under guidelines of national healthcare policies, and that ensures economically viable healthcare delivery and it prevents wastage of government expenses. Then most important function is or role is future healthcare strategy planner. So physicians collect, analyze data and utilize this data and statistics and they conduct various surveys, community based statistical research that will help or benefit healthcare delivery system, and this data it serves as information for planning future health strategies in the society. So during pandemic COVID-19 various data they are collected regarding how this virus is transmitted, how it affects various systems, which biomarkers they are changed, which type of drug that is given, and it is helpful in prevention and treatment of COVID-19. So all these things, they can be analyzed, and statistical research is conducted, and that is helpful in planning strategies for treating COVID-19 patients. So that is, for example, I am saying, and that is done for various diseases also. Then, so in social and preventive medicine, so physicians, they play very important role in giving preventive measures, strategies to prevent spreading of various communicable diseases of our country. So tuberculosis, leprosy, malaria, filaria, so communicable diseases. So they are prevented. He promotes lifestyle changes in management of disease. So diabetes, hypertension, so these non-communicable diseases with the help of lifestyle modification. So and role in improving quality of life and lifespan. So by employing preventive measures, strategies to prevent spreading of communicable diseases, non-communicable diseases, he promotes and recommends lifestyle changes in management of disease. So thereby quality of life is increased, lifespan of community is increased. Again, there is role as behavioral therapist in community. So what it means, behavioral therapist? So physicians, they are having humanistic approach. So compassion, you are knowing compassion. They treat patient with compassion. They help building trust in patients, and it is very effective in developing confidence, optimistic hope in patients. So this behavioral approach that increases or speeds recovery. So doctor-patient trust in community members, that is very important in behavioral therapy approach in community-based healthcare system. The next very important is physician plays a role in building professionalism and respect towards doctor community. So code of ethics is followed, high ethical standards are followed, and the doctors give respect to each other. They give trust and confidence to the patients. Then very important is as a role as trainers of present and future generation doctors for community. So physicians, they provide training in teaching as well as service hospitals. So postgraduate training programs are there. So doctors, they act as postgraduate teachers. So doctors teach medical students. So thereby manforce, future doctors, they are generated, and that helps in improving standards of patient care. Most important is healthcare advocate. So physicians, they are continuously learning. So they are lifelong learners. They update their knowledge, medical knowledge. So that is very important in clinical practice for diagnosis and management of diseases in community. So patients may approach a physician with local health issue, and physician can work as health advocate to convey community request to local administration or state administration. So these are various important roles of physician towards society and community. So in brief, the physician acts as medical expert. Various experts are there: pathologists, microbiologists, physicians, surgeons, ophthalmologists, obstetricians, gynecologists. So these experts, they are helpful in diagnosing and treatment. They act as health communicator, collaborator, community administrator, future healthcare strategy planner. They give preventive services, preventive medicine services, behavioral therapists, professionalism. They act as trainers to train postgraduates. Then they act as healthcare advocates. They thereby all these help in improving quality of life and community lifespan. So that is all about role of physician towards society and